Welcome. Here are a few tips to enhance your virtual experience. Adjust your volume on your computer, click the help icon for technical difficulties, and adjust your internet browser view settings by selecting Control or Control plus the buttons. Welcome to the pre-recording of the City of Manchester, New Hampshire retiree meetings. The agenda for today is, first off, why Medicare Advantage? Secondly, Medicare Advantage, the Anthem difference. Anthem's Medicare Advantage benefit summary, Medicare Part D and how it works, Anthem's prescription drug benefits, Anthem's digital tools and resources, Anthem's whole person care benefits, how to enroll. So why Medicare Advantage? So with Original Medicare, you have Original Medicare Part A, which covers your hospital visits. You also have Part B, which covers your medical visits. When you're in the Medicare Advantage plan, we all take care of all of that. We take care of your Part A hospitalization. We take care of processing claims for your Part B medical claims. There's also a Part D prescription drug feature with this plan, which you don't have with Original Medicare today. So these things, combined with all of the value added, specifically programs that we offer to keep you healthy, are something that's above and beyond what Original Medicare would normally pay for. When we look at going beyond traditional Medicare benefits, we are not just the payer of claims for you. We are actually approaching each case as if it was the whole person that we're taking care of. We have a very holistic, whole person approach to managing your care. We give you extra care when you need it, personalized connections, which I'll talk about later in the slide presentation, as well as collaborative support team to assist you through this journey. Next, we'll go through specifically what the benefits are that are being offered. So you see here on this medical benefit summary that you have in-network and out-of-network. Seeing an in-network provider is really not necessary under this plan because as long as your physician accepts Medicare or Medicare assignment, you can continue to see that physician. So that's an important distinction to make. If you see a doctor that's in-network or out-of-network, your out-of-pocket costs are going to be the same. You see a lot of zeros here. There are no co-payments under this plan, including for your preventative care, which we think is really, really important. So the end result on your medical plan is that your total out-of-pocket cost is going to be zero because you are not paying any co-payments for any of these services. So similar to your medical benefits, you see here that you're going to be paying $0 for your generic prescriptions. You'll be paying $20 for your preferred brands, and finally $40 for non-preferred brands that include specialty drugs. Now, if you want to use the mail order, and it's very simple to use, I'll go through that in a later slide, you simply pay double the copayment, but you get a 90-day supply. So again, $0 for generics. Your preferred brands will be $40. That's 2 copayments for a 3-month supply. And then for your non-preferred, you're going to be paying $80. As I mentioned before, access to providers. You continue to see your current doctor. Your doctor will keep filing claims on your behalf. The difference being the claim's not going to be filed to Medicare first. It's going to be filed directly here to Anthem. We will take care of the whole thing. You can use any doctor or care provider that accepts Medicare and the plan, and you can choose either in or out-of-network care providers, and the cost shares are actually exactly the same. So many people ask, will I need a referral to see my doctor? And the answer to that is no. You self-refer to any physician that you want to. As long as they accept Medicare, you can self-refer, continue to see your allergists, continue to see your chiropractors, continuing to see your urologist, your internal medicine doctor. You don't need a referral. Will I need pre-approval? Well, yes, in some cases you will. And this is something that Medicare does retrospectively rather than prospectively, meaning they wait until after the service is rendered to determine medical necessity. Medicare Advantage plans do that up front before you have the service rendered, so there are no surprises. So an example of what you would need pre-approval for is an inpatient planned admission, an outpatient planned surgery. Most of your physical, occupational, and speech therapies would also be prior approval needed. Now, the one thing that you need to keep in mind is this is not your responsibility. This is your provider's responsibility. Medicare accepting providers and our PAR providers know that this step needs to be taken in order to pay the claim eventually down the road. So this is not something, again, that you need to be involved in. It's something that happens directly between us and your physician. So getting your prescriptions is very easy. Remember, I mentioned that you're only going to be paying 2 co-payments for mail order. Although it's not mandatory, it's suggested only because it's more economical and you'll be paying less of a co-payment for a 90-day supply. So you can go to that retail pharmacy and go ahead and have your prescription filled just like you do today. Or if you want to, you can either call customer service or go online, and I'm going to explain how that's done in a later slide. But basically, you can set up your mail order that way and even sign up for automatic refills. So using the mail order pharmacy is really very easy. You will get, sometime in December, a packet that is a welcome packet. It welcomes you to the plan. It covers some of the information I'm talking about today. But inside that packet is a mail order form. So you can get the mail order form right out of your packet, complete it, include your prescription information, return the form and the prescriptions to the address that's listed on the form, and then once you register, you can order medications online at anthem.com, or you can call customer service at the toll-free phone number. Next, we're going to talk about Anthem's digital tools and some of the resources that are available to you through the plan. These resources are available to you so that you can stay on top of your health anytime and anywhere. The first thing I want to talk about is the Sydney Health application. Very, very simple. If you have a smartphone, you can go into the App Store and download something called Sydney Health. That is the name of our mobile website, Sydney Health. Now, you can also go into anthem.com and register that way if you would prefer to do that rather than on your phone. But most people like to have it on the phone because a lot of people are on the go. You might be a snowbird or you might like to travel a lot. So it comes in handy to have right on your phone and right at your fingertips. But if you want to do it the other way and go into anthem.com, that's perfectly fine. The registration process is almost identical. It takes about 2 minutes to get registered onto either the health app or anthem.com. Here's the important part. Once you get out there, you'll have access to digital ID cards. So even though we fully expect that you will have an identification card prior to January 1, it's nice to have it available in digital mode. You can also look at your plan. You can look at your prescriptions. You can look at your claims information. You can review your prescription history. You can turn on automatic refills. So if you want to do that through either the pharmacy or through mail order, you can do that as well. Finally, you can check drug prices. There's just so much that being a registered member makes available to you, more so than what our public site does. So we do recommend that you try and get this downloaded. And again, if you don't want to do it on your phone or you can't, anthem.com would be another way to register. So Live Health Online, this is really more or less our telehealth service through Anthem directly. So a lot of us during the pandemic weren't really going to the doctor, but there was a lot of doctors' offices that actually utilized their own version of a telehealth way to communicate with their patients when the patients needed them. This is Anthem's own version of it. It's called Live Health Online. It's a very, very helpful tool to use. We do recommend that you register for this prior to having any type of a medical situation. But what it does is it gets you in touch with a provider right on either your smartphone or your computer. If your computer has a camera feature, you'll be face-to-face with a provider that participates in Live Health Online. They can look at you, assess your symptoms, They can prescribe medicine for you. So if you're traveling and you have an urgent situation that you don't want to go to the emergency room for, they're available to help you with that as well. Again, recommendation is that you download it prior to actually needing the service. That way you have it at your fingertips and you can just go ahead. The other thing we like about this is that you are provided with an email following the visit that summarizes your conversation with the physician. So it's helpful because sometimes you don't remember everything that the physician is telling you to do. So this is a really nice tool that just summarizes the entire conversation for you that you can just file away for future use. Now remember, in an earlier slide, I mentioned that we take care of the whole person. We're not just the payer of claims. We're there to support you every step of the way in your medical journey. So in order to do that, we have some whole person care benefits that we like to just make you aware of. So the other advantage of a Medicare Advantage plan is something that we call 24/7 nurse line. So as it implies, 24 hours a day, 7 days a week, you can speak telephonically to a registered nurse. Where we find this most helpful is assisting you in assess your symptoms, understanding a condition and course of treatment. So you may have just recently been diagnosed with something and your physician has given you a course of treatment and you want to talk a little bit more to a medical professional about that. You can do that. They also address questions about your prescriptions or over-the-counter medications to see if they interact together or not. And then finally, you just receive the right care in the right setting. Obviously, if there's an emergency situation, you're not going to use this. But it is a very useful tool if you don't want to use the Live Health Online, but you do want to talk to a registered nurse. They're standing by 24 hours a day, 7 days a week, and that phone number will be on the back of your identification card when it's issued. The other thing we really like to talk about is Silver Sneakers. Now, for those of you who don't know what that is or haven't heard anything about Silver Sneakers, it is more than just a gym membership. First of all, you're not pigeonholed into one gym. So we have a whole list of facilities, gyms, that participate in the Silver Sneakers program. So if you see one of those participating gyms, you can go there and then say they have a really great swim lesson that they offer up. You could do that one day, but maybe there's a Y around the corner that participates that has a really good yoga class. You can attend that at that different facility. So this doesn't pigeonhole you into one facility. You don't just join a gym. You go to any gym that participates with the Silver Sneakers program, and you can use their facility for free. The other thing that became very popular during the pandemic was live classes through Silver Sneakers. And there's also a whole library of exercises and things that you can do right from the safety of your own home. So really great program. We encourage everybody to use it, and it is free. Now for special offers, this is something you also have to be either registered on the Sydney app or through Anthem.com. But once you're registered as a member and the system recognizes you as an Anthem member, you'll see a link out there called Special Offers. This is just a snapshot of all of the discount programs that are offered to you as an Anthem enrollee. So, for example, Jenny Craig and Living Lean, both weight loss programs, both great weight loss programs, they will offer you a discounted price to join. You also have Nation's Hearing and Fitbit, 1-800-CONTACTS. You even have Puritan's Pride vitamins to get certain over-the-counter vitamins through the Special Offers program. So something to check out once you're a registered member. So now Healthy Meals, this is another value-added benefit that you are qualified for one of three ways. Either you're recently discharged from the hospital, or you're a diabetic with an A1C over 9, or you're overweight with a BMI of 25 or more, or 18.5 or less. So if any of those conditions are prevalent with you, you can contact customer service. They will put you in touch with an individual that will be able to provide you with nutritious and balanced meals delivered right straight to your home, right from the vendor to your home. So again, there are different qualifications. Diabetic with an A1C over 9, the BMI is high, the BMI is too low, or a recent discharge from the hospital. But a very nice feature to the plan. Now for Healthy Pantry, it's slightly different. The qualifications for that plan are that you just need to have a chronic illness. So those with chronic illnesses, we want to make it a point to help you recover from that chronic illness, or at least be healthy while you're going through any type of illness. So you will receive nutritional counseling sessions by phone on a monthly basis. And then we're going to deliver healthy, non-perishable pantry items to your home as well. So same process, contact customer service or your doctor can call, and we will set you up to have this program available to you. Now with Medicare Community Resource Support, this is a little bit different because these are things that typically some people just need added assistance, and it's not something the health insurance company can do. However, we can, based on our community connections, put you in touch with a support person to help you in times of need. So here's some examples of support and resources that are included. Food pantries, home maintenance programs, utility assistance programs, copay assistance, social activities, help around the home, and travel assistance to medical appointments or the grocery store. So another very nice feature of the plan, we recognize that as a health insurance company, we can't take care of all of these things for you, but we can put you in touch with somebody right in your community that can help you. Now, House Calls program is a slightly different program in that this will actually send a licensed clinician to your home to help you talk about your health questions or concerns, give you some basic health screenings, take notes on the health discussion and record assessment results, and then finally share those assessment results with you and with your personal doctors as well. Now, what will happen, the way that this will look is that you will receive a phone call, and that person will identify themselves as a house call provider, and they will ask you, would you like some assistance in your home? And some people think it's intrusive, and if you do not want to participate, you don't have to. You just simply tell the caller that you're not interested. We'll take you off of the list. But folks that have enrolled in this house call program have really liked it. It's been really, really helpful to have somebody come into the home and just assess your situation. So just be aware, it is random and it is based on claims history. So once we have enough claims history for you, we'll be able to pick up that phone and possibly make that phone call to you. So just be aware that it exists and that it's completely optional. Now let's talk about enrollment into the plan for January 1. So if you are an existing member enrolled in the city's retirement insurance plan, you don't need to do anything. We are getting that information and we are loading your enrollment automatically. What you did receive is a pre-enrollment kit, and in there is an opt-out form. The CMS, Center for Medicare and Medicaid Services, does require us to provide members, potential members, with the ability to opt out of the plan if they so choose. However, this is very important. If you decide to opt out of this plan, you will not be able to get back into the retiree plan through the city in the future. So just something to be aware of. Again, if you do nothing, you will be automatically enrolled and you'll have identification cards prior to January 1. So here's your pre- and post-enrollment material. You would have already received the pre-enrollment kit. Then after you're enrolled, you're going to get something called the Welcome Kit. The Welcome Kit contains that mail order form that we talked about in an earlier slide. So if you wanted to use the mail order for your prescription drugs, you can do that. There's also the evidence of coverage. Now, CMS does not require carriers to provide that in the mail to every enrollee. However, you may want to have a copy of it for your records. So that will be something that you can request through customer service if you so desire. Same with the directory of doctors. Even though it's not really important for you to see a participating Anthem provider because you can see any Medicare accepting provider, we can customize the directory for you if you call customer service. Tell them that you want, I don't know, a county nearby, and you want to see all of the neurologists on the plan. We can do that for you. And then finally, the formulary, that will be posted online, if it isn't already, through the city's website. So if you want to know if a specific prescription is going to require a different copayment for you going forward, and it shouldn't, because we match the plan pretty closely, but if for some reason it does, you'll be able to look in there, and you'll also be able to call. There's a pre-enrollment support number I'm going to give you in a later slide. You can call those individuals as well. So here's the slide that shows the First Impressions Welcome Team. It is 833-848-8729, and they are available Monday through Friday from 8 a.m. to 9 p.m. Eastern Standard Time. They can provide you with pre-enrollment support. So you call, just identify yourself as a potential member through the city, and they will be able to help you with your questions, whether that is about your prescription drugs, or if a particular provider is accepting Medicare, anything that you have coverage related. You have a scenario that you're going through right now and you want to talk to somebody one-on-one about it, this is the phone number to call. So after we get through this presentation, if you still have some outstanding questions, here's where you need to contact the First Impressions Welcome Team to discuss whatever additional questions that you have. And here's some important contact information. Of course, here's the Anthem Medicare Advantage PPO Plan First Impressions Welcome Center. That's the phone number I just mentioned in my prior slide. We also have out here information on New Hampshire Retirement System Medical Subsidy, as well as the City of Manchester Medical Subsidy. So these are all very important information, contact information for additional questions as it relates to these items. So this will conclude my presentation to the City of Manchester retirees. Again, feel free to call First Impressions Welcome Line if you have additional questions after this presentation. Thank you and have a great day.